testosterone, cypronate, and ACG. We put him on DHA cortisol, compound thyroid, and multiple vitamin injectable compound, which are B12, B complex, D3, and glutathione. After 6 months, he gained back his energy. He's swimming 3 times a week plus gym, and his cardiologist couldn't believe that he recovered quickly. He now takes care of his son, who is autistic, and after 1.5 years, teaches in a local English school for the minority, and assists as a coach with the Little League Baseball. So as you can see, most likely at the point here where he was having severe fatigue, he could have had another heart attack. With the giving him testosterone and ACG had remarkably revived himself. What about integrated medicine? Integrated medicine, we have a patient here, 26-year-old female, complaining of weight gain of 50 pounds in 6 months. She was being treated by the psychologist for depression because of miscarriages ×2. Upon workup, I found her to have a low progesterone, PCOS, or polycystic ovarian syndrome, and a metabolic syndrome. I just put him on rosemary extracts, metformin, phosphatidylcholine, L-tyrosine. His nutrition is our protocol in the office, and an simple exercise regimen program. And after 6 months, he lost 50 pounds, and after 1 year, she was able to have pregnancy to a live, normal baby girl. 2 years after, continuing the regimen, lost the 80 pounds, and on the 3rd year, she had the second pregnancy to a live baby girl. A lot of these women nowadays at this age, they are unable to conceive children because of this problem. And most of your gynecologists, they put them on birth control pills at the time. But we do have some very accomplished, successful young women who want to start their lives. So they're on birth control pills, they're not able to conceive babies. So I think it's good to know that it is possible. Energy medicine. This one, CK, is a 39-year-old female complaining of anxiety, panic attacks for 8 months. She couldn't leave her house because panic attacks will set in. So she had to quit her job. She couldn't work. And this woman is spiritual. She practiced meditation and belongs to a group of spiritual beings. So diagnosed her with perimenopause and has a 15-pound weight gain. We just put her meditation and on a more frequent basis and study more about meditation, and also put her on our protocol of blood nutrition protocol and a simple exercise program. After 6 months, she lost 10 pounds, and 1 year, no panic attacks. A year and a half later, she had no panic attacks whatsoever and works 2 jobs. So those are the type of patients. I give you cases so that you will remember the type of medicine that you can have. I did not anymore put their drug regimen in their diagnosis, conventional diagnosis, because that's the most important thing to remember. Now let's talk about the disease prevalence of the year 2000 or the 21st century disease that we are afflicted. Our society are really big problem for us. We have obesity, anxiety, adrenal deficiency, longevity, and genetic diseases. Okay. So biomedical knowledge doubles every 3.5 years, and computer knowledge doubles every 1.5 years. And we as human beings and our culture, we cannot cope up with all of this fast-paced development and how to apply all this development in science, much more technology. But if we do, we will be able to allow is obesity? Obesity now affects 65% of Americans, and 40% are obese. Now, let's make a definition between obesity and overweight. Overweight means that you are above 25 pounds or 35 pounds above your ideal body weight. Now, if you are over that, now we are considered obese. Okay? And there are 22% of our young adults are already obese. And the youngest obese human being is 2 years old. It's 2 years old. It's about 60 pounds. So really, it's important that we have to deal with this in our families, in our society. Maybe our government will be able to help us with also. But we can do it just by ourselves. We can tackle this obesity problem. Okay, let's just make it very simple. The normal body weight. This is from my medical school. When I was in medical school, this is 20 years ago. This is how you're supposed to compute your body weight. 110 plus your height and 5 pounds per inch. So if you are like 5'10", so 110 times 60, so your ideal body weight is about 170, so plus minus 20, so you'll be about 180, 190. That should be your ideal body weight. Your BMI should be in men, which is less than 27, less than 24 for women. The reason why I put this slide here is so simple for all of us is because you are bombarded with myriads of information about weight loss, food, bad diets, and all we have to remember is basic stuff, okay? So, if this is, okay, this is a little bit, it tells you here, this one tells you, basic concept on nutrition. So, if we learn about what are we eating, what are we putting in our mouth, and just simple. I think we can learn this. You don't need to have high school education or have a high quality degrees, PhD, to understand this. If we know the basic facts about food in our bodies, body weight, we can do it on our own. Okay. So carbohydrates, these are your fruits and vegetables. They are called simple carbs. And you have grains, legume, bread as complex carbs. And 1 calorie for this is, 1 gram is 4 calories. Protein, you have your seafood, red meat, and poultry. And that's 1 gram is equals to 4 calories. And fats, your oils and butter, that's 1 gram per 9 calories. And how do you determine your activity? It's divided into sedentary, moderate, and high. Okay? So if you just walking and sitting and eating, that's sedentary. Moderate activities, if you multiply that 3 to 4 times like what you're doing, that would be considered moderate. High is anything like 5 or above. The athletes, people that goes to the gym 5 times a week, half an hour, 5 times a week, that's already considered high intensity activity. And then you can compute your daily caloric intake with your sedentary, moderate, high activity with a factor of 10 to 12. Okay? And to do just weight loss, you just determine your caloric intake, which is the average caloric intake for 120 to like less than 200 pounds is usually 1,500 calories to 2,200 calories. But here, just by you just reduce your caloric intake by multiplying it by 12 to 15%. These are, and then moderate again, 15 to 20%, and all in the bottom. This basic concept of food, weight loss, we must know. It's very simple. And then when you read your books, when you read these diet books, you'll be able to assess the book if it's good for you or not, okay? So, now let's talk about adrenal deficiency. We all say that the eyes are the window for the soul, but the adrenals are the exit of the soul. And this is not known to our population right now. And but in anti-aging medicine, in our society, they've been educating doctors, mostly doctors. I'm educating patients. 92% of Americans have severe adrenal deficiency. That's in 2010. 80% of Americans in 2004 are found to have adrenal deficiency, and 65% in 1987. 20% of Americans in the early 70s. What changes? What had changed from the 70s to the year 2000, where suddenly we all have adrenal deficiency? It sounds like this data was collected from our fellowship director in Epifania. Just simplify it so you can you don't need to remember all the references and stuff. Now, what had changed in our society? Why suddenly we have adrenal deficiency? And they're not even being able to diagnose it. They don't know the regular medicine, they don't know what kind of test. And a very simple test to do, your cortisol and your DHEA sulfate. That's two tests alone, they're very cheap. I think it's $100 in a regular lab like Lab4 and Quest. You'll be able to see somebody if they have adrenal deficiency. These can cause sudden death. If you have severe adrenal deficiency with a cortisol of 2 and a DHEA of less than 5, you can have sudden death. Data has been collected by the society. If we need those references, we are willing to give you in our office. Okay, what about longevity and lifespan? Okay, it just gives you here, the lifespan, our lifespan throughout the years. As you can see, we have longer lifespan nowadays. We are living longer because of the discoveries in science, and we're being able to apply that. A lot of us, even though we're not able to cope up with the progress in technology and science, there are a few segment of the population who are. So, contrary to, we're not living shorter, we're living longer. And that would be a problem, I guess, to our government or to our society. But just wanted to inform you about that. And then genetic diseases. The genetic diseases nowadays, they are not the ones that when you were born, you have cleft palate, you have heart problem. We're talking about genetic diseases that are metabolic syndrome, hypertension, heart disease, diabetes. If we're aware of these, we can prevent them. In andropause, menopause, that's when they're all setting in for us. So therefore, anti-aging medicine is really crucial in preventing these genetic diseases. And some of us had gone further in their family tree to doing genealogy in order to prevent these genetic diseases. Okay. In summary, what is anti-aging medicine? So we have, again, just put that on top, energy, you got hormones, nutrition, natural substances, and movement. Okay? In movement, the combination of east and west, you have the gym, whoever that goes to gym, and those people that do Tai Chi, yoga, Qigong, those are part of, this is anti-aging medicine. And I would end my talk from there, and if you have any question, you can, I have 5 minutes, and then we can go on with the next batch of